Last year, in the West African Republic of Benin, 16-month-old Lucien Hukpatin was crippled by polio. The highly infectious viral disease, which mainly affects children under 5, cannot be cured, but can be prevented by immunization. In 4 years, there had not been a single case of polio in Benin, but in the last 12 months, Lucien is one of 8 reported cases. The virus had been endemic to neighboring Nigeria, but now a polio outbreak was spreading across West Africa.
Nigeria used to record about 200 cases per year. And in 2003, there was an unfortunate situation of rumors about safety of the vaccine. There were some misconceptions that the vaccine was contaminated with family planning chemicals and HIV. And these rumors, unfortunately, spread very widely.
The number of polio cases in Nigeria tripled. And by 2008, the outbreak had spread to 7 other West African countries.
None of us will be free from polio until every one of us is actually free of polio. So we have to do what we have to do as a country.
Now, to stop the spread of the polio virus, a massive immunization campaign is being synchronized across 8 West African countries. The aim is to reach 53 million children in 2 rounds of 4 days each. The campaign is being led by governments with the support from WHO, Rotary International, the US Center for Disease Control, and UNICEF. Before vaccination begins, community health workers work with traditional and religious leaders to help communities to understand the importance of vaccination and allay any fears. In the Teleberi district of Niger, community leader Mahamadou Dejeng speaks to mothers and fathers about the importance of vaccination. Here, usually the father must give his consent before a child can be vaccinated. Last year, 5 families in this village refused vaccination.
Association chefferie traditionnelle de UNICEF.
The Association of Traditional Leaders and UNICEF have concerted their efforts to support the polio vaccination campaign by raising the awareness of people on its importance.
At the launch ceremony, Lamine Abdoumai, a representative of the governor, reminded the community of other diseases that have been eradicated.
We had smallpox, we had sleeping sickness, and how were they all eradicated? They were eradicated thanks to coordinated efforts of the health sector and to preventative measures like vaccination.
Having won the support of the community, vaccination can begin. In the Ivory Coast, trained volunteer immunizers are delivering supplies of the vaccine to health centers across the country. Because the vaccine is heat sensitive, it must be maintained at near freezing temperatures, a process known as the cold chain. Vaccinators must carry the day's supply in a vaccine carrier bag, cooled with 4 ice packs. In Benin, President Boni Yayi is launching the campaign in his country. The strategy is to reach every child under 5, so volunteers go from door to door, from crowded urban city centers to isolated rural communities, and even use dugout canoes to reach children in riverside communities. volunteer Albert Addingham is determined to make a difference.
No one should ever experience such a bad disease. It discourages us. That's why we decided to immunize our children.
I am very happy about this because I don't want my child to be paralyzed. That's why I accepted the vaccination.
In Madogo village, which straddles the Nigeria and Benin border, vaccinators from the different countries work in pairs to ensure each child is reached. And in the Nigerian town of Ota, in Ogun State, Suleiman Hamid waits eagerly with his 3-year-old son, Khalid.
We went to the central mosque yesterday. They told us some people used to chase the health workers away. Now they said we should allow them into our homes to give our children the vaccine.
Over 8 days, this campaign has reached 53 million children across West Africa, helping to halt this crippling disease and giving these children the chance of a healthier life.